Hello, everybody. This is Lisi, pharmacy technician at the medicine shop with our pharmacy intern, Karen.
Hello, everyone.
We are going to be presenting some highlights from our wellness class that we had yesterday. We know a lot of our patients are fighting fatigue, and we want to give you guys the tools to do so. So we're just going to dive right into this, and I really hope that this is helpful for those of you who are trying to conquer this issue. So our first question today is, what is fatigue? Karen, can you explain that to us?
So yeah, definitely. So fatigue is a general feeling of tiredness or when you're unable to complete your normal daily activities. That's what we call a fatigue.
Okay, so just being like worn out, no energy, just feeling yucky. Okay, so if I was a person who was battling fatigue, how would I go about it? How do I fight fatigue?
So pretty much losing your weight. So weight loss or moderate exercise. So maybe walking, jogging, or doing some weight training, weightlifting, or a well balance of your diet. Pretty much.
So nutrition.
Nutrition, and avoid caffeine, alcohol, and nicotine.
Okay, so how can those three substances affect fatigue? So if I drink Rockstar energy drinks, say I drink one of those every single morning, how can that affect fatigue if I'm already someone who's tired and I think, oh, well, I need a Coke or I need a Rockstar to bring my energy up? How is that bad for my fatigue?
Okay, so if your body is tired already and then you're trying to get you more caffeine or more energy boost up, it's gonna lose more of your energy. So that just make you more tired, even though like your brain will probably feel like you're like super excited, but you're mentally exciting, but then you're physically
your body
very
doesn't
tired,
feel
exhausted. So that's why we wanted to avoid that. So we want to avoid that emotional feeling of excitement.
Okay, so from what you're saying, it almost seems like with these negative effects from those three substances, it can also maybe even affect your mental clarity. So it might be harder to concentrate at work and things of that nature if you are consuming extra. Okay, all right. So how exactly would I fight fatigue with exercise?
So exercise in the morning, you can spend about 10 to 15 minutes. Start a morning stretch. So we don't want you to wake up and just jump up off your bed, right? We want you to slowly stretch a little bit. And when you feel ready, then go ahead and stand up and then just stretching and then just increase that blood flow. Okay. So maybe like patting yourself, that can helps your blood circulation since you're laying down for a night, so it will be good to help that.
Okay, awesome. So I know some people like to take showers in the morning. Some people are evening shower takers. I know when I was in school, my mom wanted us to take all our showers in the evening. That way, when we were getting ready for the bus at 6:30 in the morning, she didn't have to worry about us, taking a long time to get ready. Would you recommend one or the other? Do you think like taking a shower, like a nice warm shower in the morning would be good to help increase circulation, or do you think it matters?
Well, definitely when you take a hot shower, it will increase your skin, like the blood circulation on your skin. So if you enjoy that, I would say you can do that in the morning, but if you like relaxing at night, then you can do it at 9 or whenever you feel like it.
But still stretch in the morning.
Still stretch. You can spend about 10 to 15 minutes. It just because you're sleeping for over 6 hours and you're probably not moving, so it's good to not suddenly just wake up, gently stretch yourself. And also during the day, you can spend about 2 to 3 minutes to stretch out. For example, if you just feel tired or during the day, for example, if you work in a pharmacy and then you stand for 10 hours pretty much every day.
We do stand a lot.
So what you should do for stretch? Jumping jack, right?
I never liked those.
Well.
Okay, I had a question for you. Shoot, what was my question? Oh, yeah. It wasn't a question. Actually, it was a comment I wanted to make. We offer a platform called the Spark platform for our patients and community members, and it's completely free. And Karen just reminded me when she was saying, you want to stretch. I know that some people are out there watching this, and they're thinking, well, what kind of stretches or what kind of exercises that I do? If you guys want to set up a profile on our Spark platform, you can access our meal mixer for healthier meals. You can kind of decide, I want Italian, I want Mexican food, I want this, I want that, but I only have chicken in the fridge, so it can help you with recipes. Also, we have an exercise mixer, and it has different videos, and it shows you how to do the different exercises. So if you guys are wanting to start doing different exercises, like we were suggesting for 10 to 15 minutes every day, you want to have some ideas for that, ask to be set up on our Spark platform. All you need is an email address, and we can get you guys set up. It's super, super easy. And you can even check in with Scott and me. You can put your blood pressure in there. You can just simply send us messages and say, hey, this is what I'm dealing with. What's your suggestion, so on and so forth. So definitely ask about our Spark platform for those of you who are interested in accessing those tools. So going right along, next thing that we want to touch on is diet. And I talk so much about this with patients generally. A diet is not something you go on temporarily. It's what you put in your mouth. What are we giving ourselves? How are we nourishing ourselves? So how does our diet affect our fatigue levels?
Okay, so definitely, for example, if you just wake up and you feed yourself a really high sugar of granola bar, so it's definitely gonna boost up your sugar level, glucose level, and then what if you have high glucose level? You feel tired, and then you just feel sleepy. So then it's a good way that you start with a healthy breakfast. For example, you have more proteins and add fruits and vegetable in there. So those are low in glucose level food. So it won't raise your glucose level in your blood too fast, but then keep you energy, because we know proteins and good fat, those have more energy and you can burn longer, so you can wait longer for your lunch.
So we're wanting a more nutrient-dense breakfast than we want
definitely
caloric.
So have more fibers and more healthy proteins and
berries. Eat berries. Berries are very good for you.
Very antioxidant.
Okay, so let's see. Moving right along. What's next here? Okay, so can my sleeping affect my quality of sleep? Can it affect my fatigue levels?
Definitely. So we want a good quality of your sleep. That's the best way to, for example, if you're sleeping for 7 hours, but you wake up 4 times during the night, and then so you wake up in the morning and you was like, I feel like I sleep for a long time, but why am I still tired? So that's what we call a not so good quality of sleep.
Okay.
But if you sleep through the entire 7 hours, then that's a good quality of sleep. So we definitely want that. Okay. And there are some tips that we can, for you to have a good quality of sleep. For example, avoid caffeine or nicotine and alcohol. Again, for those.
And is that just generally or right before bed?
I think in generally. Because, it depends. For younger people, like, I won't say me, but
we're young.
Maybe,
we're young.
Yeah. So for us, younger people like us, we can tolerate the caffeine. Might be faster than my mom, like 65 years old. So she tried to avoid caffeine because she just have one slip of coffee in the morning, like latte or something. She will bother me at night.
She's bouncing off the walls.
Yeah, she was like, dang, I shouldn't have that coffee in the morning. It's all your fault.
Smart.
Yeah.
So if you wouldn't give it to a kid, then it's probably not a good idea for you to consume it. Right?
It depends.
We're not giving our kids caffeine, nicotine, or alcohol. Okay, so let's see. How about exercise? Does it matter, like, your exercise timing?
Yeah. So we want to have at least 3 hours. So before you sleep, so we want 3 hours. You don't want to exercise for 3 hours before you sleep. So
okay, so we want to try and maybe do our exercising towards the beginning of in the
Towards
middle
the
of the day.
beginning, or even though you after your dinner you can go out for a walk for 30 minutes, that's fine, as long as it's 3 hours before your sleep
Okay.
bedtime. Yeah.
All right, that makes sense.
Yeah.
And then how about eating? How about I know a lot of people who like to have, you know, a little something before they go to bed because they have a sweet tooth or something like that.
Yeah.
Do you think that would affect their sleeping, their quality of sleep?
I would say if you have a lot of heavy food, for example, really like fast food or
Calorically dense food.
like sugarish food, that will give you acidity in your stomach. So when you lie down right away, you might have a what we call the acid reflux. So you might have a GER or something
could
that
be
just feel very
uncomfortable.
uncomfortable. So we wanted to avoid heavy food generally for dinner.
Okay.
Yeah, but like if you have like light food, for example, like vegetables or I mean protein are fine. Like at least 1 hours before you sleep. So don't anything. I think
Okay.
even though fruit,
Okay.
you should still have probably an hour.
Okay. And then how about like dinner, for instance? Some people, you know, they, like me, for instance, I get off of work usually like a couple minutes after we close. And then by the time I go home and, you know, we get stuff ready for dinner and we get the kids ready, you know, we're not eating sometimes until, you know, 7:30 or 8 o'clock. Would you suggest for people who are eating dinner late to try and go to bed later? Or just eat a lighter dinner?
I would say eat a lighter dinner, yeah, because we want a good quality of sleep and as more sleep as you can, at least 7 hours per day of sleep. It's generally enough.
Perfect.
So yeah, a smaller portion if you have a heavy food.
So it sounds. I
a
mean,
little bit.
a lot of what we're saying is talking about nutrition. I mean, if you think about it, nutrition, well, water, of course, is the most important nutrient out there, but your nutrition seems to be connected with this topic a lot. So I think that maybe if we start focusing on our nutrition and what we're putting into our body, make sure that we're nourishing our body and not necessarily just filling our body with empty food. We want nutrient dense foods.
You want to eat what's good for you.
Okay. And then how about, I know with me, like, you know, doing videos and stuff like that, sometimes I'm on my phone. I was on my phone, I think, until almost midnight last night.
Me too.
So what do you have to say for those? Because this is a generation. Now we live in a generation who's always on their phones. They're always on their computers.
Yeah, definitely.
Even our older patients are very technologically inclined, and they're on their computers as well. How would you say technology could affect your fatigue levels?
Yeah, so when you see your cell phone right before you sleep, or playing your iPad or watch TV or watching computer, I mean, the light just can wakes you up, right? Like you just like don't want to sleep after you start playing those apps on your phone. So we want to have at least 1 hour break time.
Downtime?
Yeah,
Okay.
downtime. But I know it's hard. So, but just
downtime
try your best.
before
But
lay
just try your
down
best.
time.
And I know for people, if they just couldn't fall asleep, for example, I sleep at 10 o'clock and I couldn't fall asleep until still like for an hour. I'm still awake at 11. I would recommend you to just wake up and do something. For example, like reading books.
Okay.
It can be boring, or just start studying or doing something that you don't enjoy to do that can help you fall asleep. But not trying to just keep pushing yourself go to sleep. I know that can be stressful. So maybe wake up and do something else, and then you will get tired. So then go to sleep.
All right, that sounds good. All right, and let's see what's next. So, okay, yes. So what if we're following all of these instructions? We're watching our water intake. We're making sure to drink the right amount of water. We're eating nutritious foods. We're not playing around with our phones and our technology an hour before. We're making sure that we're exercising in the right window. What if we're doing everything that we're supposed to do and we're still tired?
Okay. So first, you should ask yourself, so what medication I'm taking, right? Or maybe I should do some physical check. For example, if I have some of the disease that can cause you fatigue, feeling more fatigue. For example, if you are anemic, like your anemia, or if you have any thyroid problem, like hypothyroid problem, or if you're diabetes, or if you have any kidneys or liver disease. So those diseases can cause you feel fatigue.
Okay.
So maybe you follow up with your doctors and check up with those physical exam.
Okay.
Or like checking your medication, see if there's any side effect that cause fatigue.
Okay, that's good. So check with your pharmacist. If you are still, checking all the boxes on the stuff that we've talked about here within the past few minutes, and you're still experiencing fatigue, check with your pharmacist, see if there's any side effects to the medications or with the medications that you're taking currently. And if you're not taking medications or there aren't any side effects, contact your physician and talk to them and see about alternative ways to fight your fatigue. Okay, let's see. What do we have next here?
So just don't accept fatigue as just another part of life with heart disease. So don't just feel like, oh, I'm just fatigued and I'm just gonna live with fatigueness, right? You should try to help that and find out what causes you feel fatigue, and then find a solution. I mean the treatment, it's easy, and the diagnosis can be easy.
Okay. Let's see. What was I going to touch on something related to fatigue. Oh, yes. I'm thinking about things while she's talking. I don't want to interrupt her. Fatigue is actually one sign, one of the few signs for women for heart attack. And the signs for heart attack between men and women are very different. With men, sometimes they have the, arm pain and chest pain and stuff. But for women, oftentimes it can be nausea, fatigue, and things of that nature. And so we as women sometimes will say, it's because I was shopping all day long and it was hot in Tucson and I'm just really tired. Listen to your body. Don't just set your health to the side. Your health is so important. So if you don't feel right, get yourself checked out and bring it up to someone so that you're not, overlooking something that might be even bigger than we may think. So let's see. I know we've talked about, is there a connection to quality of sleep? But when you're sleeping, I know that, say we've been looking at our phones, so that obviously affects our quality of sleep. Maybe we worked out a little bit too late and did some cardio, so we got our heart rate pumping a little too close to our bedtime. What if there are actually issues like sleep apnea? What would you suggest for people who are experiencing that, and what is it? Can you explain it?
Okay, so first, sleep apnea is a disorder which it's the upper airway collapse when you breathe in, so causing a stop breathing for several seconds. For example, sometimes if you're sleeping next by your dad and you feel like, Dad, you're not breathing, right? And then you just start doing this
to make sure. Are you alive?
That's what we call sleep apnea. Like there's a gap. It sounds like you're not breathing, but then you back to breathe again. So with
so that airway is
collapsed for several seconds. So those we call it sleep apnea.
So what do we suggest for patients who are suffering or who think that they may be suffering from sleep apnea? So one sign of sleep apnea. So if you don't know that you have sleep apnea, some signs that can tell you that you are experiencing sleep apnea are snoring, morning headaches, waking up with a dry mouth because you've got that air coming through your airway.
You're probably breathing with your mouth
because you can't get the the oxygen that you're needing through your nasal passage. Let's see, what else? What other signs of sleep apnea are there?
So sleep apnea, for example, mood swings, or a shortness of breath, or waking up suddenly, gasping. So
that's a pretty good indicator, right?
So
let's see. So what are some concerns? So I know we were just talking about, don't just push fatigue to the side and say, oh, it's just because I did a lot today. What about sleep apnea? if we know that we have sleep apnea or we think that we might have sleep apnea, what are some dangers that are associated with that?
So that can be associated with high blood pressure, what we call a hypertension, or an enlarged heart, so or reduced ability of heart to pump blood. So your heart is not doing their work, right? And then cardio, dysrhythmia, so your heart irregular heartbeat, and heart attack and stroke. So those can be danger of sleep apnea. So those can be signs, symptoms, yeah.
So don't not get yourself checked out. If you think that you have sleep apnea, you have one of the signs, or one or even a couple of the signs, talk to your doctor and see about something that might be able to get you fixed up so that you're not experiencing those side effects and that you're not at high risk for those dangers.
Those sleep apnea is not happen to everyone, so you better you should check out or follow up with your physician to find what causing you that. So.
Would you say that there are specific patient demographics? Like, do you think that there are specific people who experience sleep apnea, or do you think everyone could be affected by it?
I mean, everyone could be affected, but